frontier. Okay. And another question, what's the muscles there? Which are the muscles on the lower limb? So we've done sartorius. Sartorius is a thin muscles from here to here. Anything else around?
Hamstrings.
Yes, hamstring. Where is it? On the back, front, on the back. It would be the hamstring. Quadriceps. Yes, it's antagonist to the hamstring. What does antagonist means? Opposite. So one flex, one extend. Right. The quads would be all the way here below the knee even. Good. Any other muscles?
Soleus.
Soleus. Where would it be?
The calf, the back of
the back of the calf. Right. Soleus in here. And on top of soleus, another muscle. Gastrocnemius. Good.
And the Achilles tendon.
Achilles tendon. Right. In the Achilles tendon. Good. Anything else we need to know? Maybe two more.
One on the front.
The one on the front.
Tibialis.
Tibialis.
Anterior.
Front is anterior. So tibialis anterior is on the front. Can you palpate it on yourself? Yeah. What I would like you to do, go onto the middle of your thigh, leg, and I want you to feel the shin bone. Do you feel the shin bone? Go opposite to the shin bone and do that movement. How did this movement called? Dorsiflexion and plantar flexion. Remember? Do that, and every time you do dorsiflexion, you would feel tibialis anterior. Yeah, do you feel that?
Yeah. It's on the lateral side, isn't it?
It's on the front lateral.
Yeah.
Front lateral. And when you do plantar flexion, it's gastrocnemius. Yeah? Fantastic. We have few more of these muscles. First is the adductor, the inner muscles. When you kick the ball, yeah, or when you bring the leg back in. So riding horse is a good example when people have adductor problem, because they're squeezing the horse not to fall. That movement would tense this muscle. And it's not a muscle, but if we talk about the iliotibial band, not, yeah, on the side, the band on the side, sorry? All the way below the knee, yes. Did we talk about it? No. It's not a muscle, it's really a piece of connective tissue, but very important to know about it. So it might be not in the required muscle, but I will add my massage right now into it. Fantastic. So you see, muscles are hard, but if you take it by region and learn it, especially the arm and the leg, these are the easiest to start with because they're running up and down and they are separate one muscle from another. If you go here, sometimes it's kind of a mesh. Yeah? So I would strongly suggest start with the limbs, with muscles, and then move to the torso. Okay, good. So, by the way, what can we palpate there? What sort of bony landmarks can we feel? From the hip.
Greater trochanter.
We can feel the greater trochanter. Where would it be? On the side? Kind of low, actually. Can you feel it? It's kind of lower than you think. What's that in here? Iliac crest, good. Greater trochanter, good. What else can you feel?
Sacrum.
Sacrum, wonderful, good. And then what?
Tibia.
You can feel the tibia, yeah, in here. You can feel the knees, yeah. You can feel those bits in here, the knee joint and the knee cup, but the rest of it is kind of covered with muscle, yeah. Okay. So when you start to just be aware that you need to palpate and feel, oh, that's the knee cup, I feel it. That's the ankle. That's the here, greater trochanter. I feel it. Okay, let's say we turn the client facing up. We can do a nice hold. Hold can be here, or you can do a hold, nice hold on the foot. And really take the time with the hold. Good. And then we're starting the place here. Good. How do you actually drape the client? Yeah? You can fold this towel to about here, and then you're taking the top towel from here and from two spots, and then you do kind of that movement, yeah, to here, and then you just help it a little bit more, and it's ready. Yeah, try not to move it too many times, and try to keep it as clean. Do you see the crease here? To be kind of straight. Yeah, I see some students, you know, they could, even therapists, they can do something like that, and it's right. This is even better, good, but sometimes they just try to, they have huge amount of towel and it can move in not a nice way, yeah? So again, try to fold it a little bit, and then a quick movement, and then just underneath it here, that's ready, yeah? So it has like a diagonal shape. Okay. So what are we starting with? Effleurage. The front of the leg is very similar to the back. It goes up and down, muscles are on the same direction. But one difference is that it's long. So be aware. If I'm short, I may be able to do only that. So what I would need to do is actually do step and step, and it will take me back and forward, okay? So I will do here, and then step and step to here, back. So a lot more leg work. I don't want to see that. Well, I need to reach there. Oh, you don't, you know. You need to reach there, but yeah, good. So one, it's okay, Samir. It's good that you're doing it.
Okay.
Yeah, good. Okay, I need a little bit more oil. Good. Then I can start with the Petrissage. Now, Petrissage, in the front of the leg, this is a bone. Be aware of it. This is, which muscle would be here?
Tibialis.
Good. Do you want to dorsiflex your foot? No, dorsiflex. Right? Yeah, do it again. Can you come close and see it? Yeah, relax and dorsiflex. Mm-hmm. Yes, do you see it? Relax and a few more times. Mm-hmm. Yeah. One more time. Good. Mm-hmm. So that's where the muscle is. So you can work on these muscles from the side, but actually I'm taking a little bit of the gastroc. Yeah. Okay. You can slow down. You can also do some Petrissage with knuckles. So really taking it from here. You know why I've stopped here?
Because of the knee.
Okay.
I feel the bone. Yeah, so the knee, yeah. Right, I felt a tightness here, okay? What sort of technique do you recommend me to go on from here?
Carry on with Petrissage.
I did Petrissage, this is Petrissage.
Okay.
So what's next? Compression, okay? hold it and letting go. Do a bit of effleurage, and again. How's the pressure? Too much? Can I go
No
deeper
more.
or no more? Good. Good. Going upward, I have here 3 groups of muscles really. The front, the in, and the out. Yeah? And I can sometimes do 2 of them together or sometimes 1. For example, I want to start with the adductors. Yeah? Do you see what happened? The leg turned a little bit out. Yeah? Petrissage to that area, or if I feel that I need a bit more effleurage, I will do that. And then I can do petrissage. Or if I want something more global, how do we call this technique?
Ringing.
Ringing. Good. Sort of figure of 8 or kneading. Yeah. And then I need to be more specific. Okay. I start feeling here. Compression. If needed. You may decide not, you can continue. Yeah?
Sure, if someone has tension there, might you feel it when they're face down? When you're
You
doing
could
the
do also.
hamstring?
Yes, of course. Yeah? So now to the front. You can work with your knuckles. Reinforced hands. The dorsal of your hand. Do you remember that? It's kind of a revision on the back, really. Yeah? Now that could be kind of hard. So again, when I go deep, I need to ask more about the pressure. But how do I ask about the pressure in an elegant way? What do you really need to know?
If you can go more.
If you can go. So, yeah, rather than to ask, how is the pain or is it painful, I would ask, can I go deeper? And you know right away what you need, you know? They say, no, too much, or can I go deeper? And then don't go deeper. Because sometimes you ask and do something different. Or just do it slower. If you need to work a little bit higher, rearrange it and then work. But I would say that's it, really. Is it tender here more? So slow down. Work up. Reinforced fingers. If you need to do ringing, then ringing. Lifting would be nice here. Hey, a little bit of oscillation, yeah. Okay, the last group I wanted to talk is about the lateral one. It's mostly this iliotibial band that goes all the way here and actually goes to the hip. So what you can do, look, naturally the leg turn out. So what you can do is one leg would be turn it a little bit in from here and keep it. And then you start with effleurage. And then you can do knuckles, but be aware it can be very painful in that area, especially for runners or active people. They can be really tight for them. Is it enough or deeper? So I need to move. If you want, you can come from the other side. Think how to make things easier for you. So if I'm on the other side, my hands are just there. Very simple. I take a little bit the hamstring even, yeah? Come here. With the base of the wrist, it can go. And then again, effleurage. The effleurage on the limbs is toward the heart, but you can go backward, but you don't press on that. So you put more pressure and then go empty-handed.
Is that to do with the lymph system?
With the veins and lymph, yeah. You drain it towards the heart. Yeah, okay. We're not going to do now the feet, and we'll do it next weekend. Right, next one, you can now bring this one back, and you can do the rest of the technique. You can do nicely the deportment. Or you can do the oscillation that we've learned. Vibration. Yeah, and then move to the other leg.
Just a question, with leg massage, is it better to massage along the fibre of the muscle or across the fibre?
You can do both. So you see, for example, when we did ringing, it's across the fibre because the fibre goes up and down.
Or if the person's got, for example, some adhesion or some scar.
Then you do both, or because you never know how the adhesion formed. Then if the adhesion happened, that you go that way and then you go this way, and you're trying to find out where you have resistance and work more on that. Yeah, but it's kind of impossible to know if the adhesion formed in one way.
One more question. The
Yeah.
IT band, is it better to work on it when the person's lying face up, or can you do it lying face down?
You can do face down, but it's possible both ways. The best way really is side lying.
Okay.
Because when they're side lying, and when we do side lying technique, you would see that that's the best way really for iliotibial band. It's kind of an important muscle because sometimes your whole backache caused by that, but we'll explain it some other time. Yeah, good. Shall we